In this module, we will review Nobleman Care Services Emergency and Disaster Preparedness Program. Emergency preparedness is a critical part of home healthcare because our staff work in patients' homes, settings that cannot always be controlled or predicted. Whether the emergency is a natural disaster, household incident, medical emergency, or community-wide crisis, it is essential that employees understand what to do, how to respond, and the protocols that keep both patients and caregivers safe. Our agency's emergency management plan ensures continuity of care, establishes communication procedures, and outlines each staff member's responsibilities before, during, and after an emergency. Disasters and emergencies can happen unexpectedly, but a well-trained workforce can significantly reduce risks, improve outcomes, and save lives. You play a vital role, and your preparedness matters. Nobleman Care Services Emergency Management Plan serves multiple purposes. First, it ensures compliance with federal, state, and accreditation requirements. Second, it establishes a consistent protocol to follow in any emergency situation, whether inside a patient's home or affecting the entire community. The plan covers the 4 essential phases of emergency management: mitigation, actions taken to prevent or reduce the impact of an emergency; preparedness, planning, training, and organizing resources before an emergency occurs; response, immediate actions during an emergency to ensure safety and continuity of care; recovery, steps taken after an incident to restore operations and support patients. Every employee is expected to understand these phases and follow the procedures outlined for each. The emergency management plan is updated regularly, and employees will be notified when revisions occur. You may request access to review the full plan at any time. The administrator at Nobleman Care Services serves as the disaster coordinator. This means the administrator is responsible for directing all aspects of the emergency management program. Key responsibilities include ensuring all staff understand their roles during emergencies, coordinating training and drills, maintaining communication systems, overseeing patient safety procedures, evaluating emergency response effectiveness, holding debriefings following major incidents. Employees also have critical responsibilities. These include knowing the agency's emergency protocols, keeping personal and emergency contact information updated, following instructions from supervisors during emergencies, reporting unsafe conditions, maintaining composure, professionalism, and safety. During home visits, employees must always be alert to hazards such as fire risks, electrical dangers, oxygen tanks, pets, cluttered walkways, or unsafe environmental conditions. If you identify an unsafe situation, you must report it immediately. Home care workers may encounter a wide variety of emergencies. It is important to be familiar with the different types so you can respond effectively. Examples include 1. Medical emergencies, patient falls, breathing difficulties, chest pain, sudden changes in consciousness, sudden severe pain, uncontrolled bleeding, hypoglycemia or hyperglycemia. 1. Environment or facility emergencies, house fires, carbon monoxide leaks, water leaks or flooding inside the home, gas odors, downed power lines, dangerous pets or wildlife. 1. Natural disasters, hurricanes, tornadoes, severe thunderstorms, flooding, extreme heat or cold, earthquakes, if applicable to your region. 1. Community incidents, power outages, water supply disruptions, transportation shutdowns, civil disturbances. 1. Infection control emergencies, exposure to bloodborne pathogens, infectious disease outbreaks, pandemic response. Each type of emergency has a specific set of procedures, but the priority is always the same: ensure safety, call for help, communicate clearly, and follow agency protocols.
Emergency preparedness begins at admission. Every patient receives an individualized emergency preparedness assessment and plan. This assessment includes key information such as patient's medical conditions, functional limitations, required equipment, medication needs, emergency contacts, whether the patient uses oxygen or electrical equipment, evacuation needs, local support resources. As a direct care employee, you must verify that patients and families understand the emergency plan. This includes reviewing evacuation routes within the home, confirming emergency contact numbers, ensuring a backup plan for power-dependent equipment, and helping identify any barriers to accessing emergency services.
Clear and timely communication is essential during emergencies. Nobleman Care Services maintains multiple systems to support communication even when normal channels fail.
If an emergency occurs during a patient visit, ensure your immediate safety. Ensure the patient's safety. Call 911 when appropriate. Notify the administrator or supervisor. Document the incident fully.
If a community-wide emergency occurs, such as a hurricane or power outage, you will receive instructions from the administrator regarding reporting to duty, adjustments to patient schedules, priority patients who require urgent assistance, changes in communication procedures, whether home visits are temporarily suspended.
Always ensure your phone is fully charged before shifts, and keep emergency contact numbers stored in your phone and written on paper. If communication systems fail, staff are expected to follow predetermined check-in procedures. Some emergencies may require patients or staff to evacuate, others may require sheltering in place. Each patient's emergency plan indicates whether the individual needs assistance evacuating and identifies appropriate shelters, including special needs shelters, if evacuation is necessary. Follow instructions from emergency authorities. Notify the administrator as soon as safe. Assist the patient only within the scope of your training. Never put yourself in danger if shelter in place is required. Ensure patients have access to food, water, medications, and necessary supplies. Maintain communication with your supervisor. Monitor environmental conditions such as temperature, ventilation, and oxygen safety. Understanding the difference between the two procedures allows you to act quickly and safely. Once an emergency is over, follow-up is just as important as the immediate response. After any incident or disaster, employees must report their status to the administrator, document the event clearly and thoroughly, participate in debriefing and evaluation, assist with continuity of patient care, identify any hazards that remain, support the patient in returning to normal routines.
The administrator will review emergency responses to determine what worked well and what can be improved. Your feedback is essential for strengthening the emergency management plan.
In summary, emergencies can happen at any time, and preparation is essential to ensuring patient and caregiver safety. Nobleman Care Services Emergency Management Plan outlines clear steps for prevention, preparedness, response, and recovery. Your role is to remain alert, communicate effectively, follow procedures, and prioritize safety in every situation. By staying prepared, you can help protect lives, reduce risks, and ensure continuity of care, even in the most unpredictable circumstances.